Due to the fact that cancer is the most common cause of death in the world, it's very important to talk about the way that this pathology can be treated during the time the patient might have been carrying it, since the doctor's diagnosis was true about it. For this reason, the discovery of a new source to fight against this type of disease is a very important issue to discuss for the future of medicine. Historically, there have been three pillars of cancer treatment: surgery, chemotherapy, and radiotherapy. In recent times, immunotherapy has surfaced as a possible fourth pillar, targeting cancer not by its anatomic position or propensity to divide, but by the essential mechanism the vulnerable system uses to distinguish between healthy and pathologic doubles. Consanguineous T-cell remedy is one gravestone in this new pillar, a potentially important approach to cancer treatment that relies on the infusion of expression-specific T-cells. Employing the vulnerable system to analyze and destroy unuseful cells has been the central theme of anti-cancer immunotherapy. In recent times, there has been an increased demand for this technology in order to make it an affordable treatment. Using this approach, unuseful-specific cytotoxic T-cells are invested into cancer cases with the idea of analyzing, targeting, and destroying T-cells. For this procedure, a CAR T-cell therapy is required. First of all, it's necessary to remove blood from the patient to get T-cells. Once we obtain them, it's similar to TIL therapy, but your T-cells are changed into the lab so that they make a type of protein known as CAR before they are grown and given back to you. CAR stands for chimeric antigen receptor. CARs are designed to allow the T-cells to attach to specific proteins on the surface of the cancer cells, improving their ability to attack the cancer cells. The process of growing your T-cells in the lab can take 2 to 8 weeks. During this time, you may have treatment with chemotherapy and maybe radiation therapy to get rid of other immune cells. Moreover, this treatment uses immune cells that are grown in the lab, followed by administering them to the body to fight the cancer. After this, tumor-specific T-cells can recognize overexpressed antigens, neoantigens derived from germline mutations, also called cancer germline antigens expressed during carcinogenesis. Excrescence natural mechanism includes staging of suppressive factors similar as TGFP or expression or checkpoint peptides. Also, fortunately, using this type of therapy for these two types of cancer, leukemia and prostate cancer, has shown records and good statistics of people that have fight properly against these two types. No longer any doubt that under optimal circumstances and for certain cancers, ACT can induce regressions of established tumors. This has been shown in a number of malignancies ranging from melanoma to certain types of leukemia, as well as prostate cancer. While the initial studies and results are very encouraging and provide proof of principal evidence, several aspects of ACT need to be optimized. Current efforts focus on expanding affordability and availability. This ultimately depends on a surge of tumor-specific T-cells that can be generated cheaply, reliably, and quickly.